Welcome to this edition of the Designs for Health audio science article.
Can lipoic acid improve insulin sensitivity? To say type 2 diabetes and related comorbidities stemming from chronic hyperglycemia and hyperinsulinemia are epidemics is an understatement. In the industrialized world of the 21st century, people who have healthy glucoregulation and insulin signaling are the exceptions, not the rule. A low-carb diet is one of the most powerful and effective non-pharmaceutical and non-surgical interventions for lowering blood sugar and insulin and for decreasing inflammation and oxidative stress. That being said, sometimes even when individuals change their diet and lifestyle habits, they still need some extra help. Chromium, magnesium, and inositol spring immediately to mind for being useful here. Beyond that, there are other nutrients that are especially beneficial for improving the downstream complications of type 2 diabetes. To find one, all we have to do is go right to the beginning of the alphabet, alpha lipoic acid. Alpha lipoic acid, or ALA for short, is a sulfur-containing compound that exhibits amphiphilic antioxidant properties, which means it works in both aqueous and lipid environments, cytosol plasma membranes, serum, and lipoproteins. Lipoic acid is best known for its antioxidant capacity, but this molecule has also been shown to have potent effects on blood glucose control via improved insulin secretion and sensitivity. Humans synthesize small amounts of ALA, so it's not an essential nutrient, although it was once classified as a vitamin before it was known that humans do produce some endogenously. The precursor is octanoic acid, or the 8-carbon medium-chain fatty acid, caprylic acid. However, even though we do generate ALA, as is true for many nutrients, certain patient populations may benefit from higher amounts than they produce and amounts higher than they would typically get from food. The richest dietary sources of ALA are mammalian proteins with high metabolic activity such as heart, liver, and kidney, not exactly regular features on dinner tables in North America. Plant foods also contain some ALA, but in much smaller amounts. In order to get pharmacological benefits from ALA, a pharmacological dose would be more appropriate. Higher doses, orders of magnitude greater than that which is endogenously produced or available in food, have been shown to be safe in animal studies. The no observed adverse effect level is considered to be 60 milligrams per kilogram of body weight per day, and studies using oral ALA for diabetic neuropathy at doses as high as 1,800 milligrams per day for 6 months and 1,200 milligrams per day for 2 years did not result in any serious adverse effects. Regarding diabetes, studies demonstrate that lipoic acid aids in glucoregulation by facilitating proper functioning of the insulin receptor and recruitment of insulin-sensitive and insulin-independent glucose transporters, GLUT4 and GLUT1 respectively, to muscle and adipose cell membranes. These seem to be the main mechanisms by which ALA increases glucose disposal. Its effects on glucose transporters led researchers to say that ALA has an insulin mimetic property. And considering that many type 2 diabetics are actually already hyperinsulinemic, it might be helpful to have a compound that has a glucose-lowering activity without adding more insulin to the fire. The benefits of ALA for diabetic complications are so well regarded that ALA is available as a prescription quote-unquote drug for neuropathy in Germany. Reviews and meta-analyses support the impressive efficacy of ALA for neuropathy. Beyond neuropathy, diabetics often have compromised energy generation resulting in fatigue. ALA is an essential cofactor for several mitochondrial enzyme complexes that catalyze critical reactions related to energy production and the catabolism or breakdown of alpha-keto acids and amino acids. Another common comorbidity of type 2 diabetes is compromised vascular function. A double-blind, randomized placebo-controlled trial showed that compared to placebo, 600 milligrams per day of intravenous ALA for 21 days improved endothelium-dependent vasodilation in type 2 diabetics. ALA has also been shown to improve nitric oxide-mediated vasodilation in diabetic patients. Researchers looking at ALA for vascular function have hypothesized that ALA helps by reducing oxidative stress, particularly in patients with an imbalance between increased oxidative stress and depleted antioxidant defense. This is a plausible mechanism. It has been called the antioxidant of antioxidants. In its reduced form, it serves to recycle vitamins E and C, coenzyme Q10, and glutathione. Coupled together, oxidized and reduced lipoic acid have a greater redox potential than oxidized and reduced glutathione, leading some researchers to refer to lipoic acid as a universal antioxidant. This being the case, it's hard to imagine a tissue system ALA wouldn't have a beneficial impact on. Owing to its potential insulin-mediated glucose-lowering effects, patients adding ALA to a regimen that includes insulin should be monitored closely to ensure healthy blood glucose levels.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.